Two. Great. Everything is working smoothly this morning. I always like it when things go smoothly. It doesn't always happen that way. So I kind of get a deep breath and say, okay, good. Take a coffee and then we'll go. So, Well, my clock shows it's 10 o'clock. So why don't we go ahead? I'll say a few words of welcome and introductions, and then we'll get the program started. So good evening, good evening. What time of day is it? I thought I was together. Good morning, everybody. I'm Clayton Cheever. I'm the Assistant Director at the Thomas Crane Public Library in lovely Quincy, Massachusetts. I'm so glad that you joined us this morning for what's going to be a fabulous program all about falls management, stress management, falls prevention. We don't need to manage falls, we can prevent them. So I'm still working on getting the coffee loop. We'll get there. We have, so glad to have you here. This has been an ongoing series of programs that we've been doing with Debbie Toomey. We have a special guest today with Kristin De Jong, who Debbie will say a little bit and we can introduce a bit more. But I do want to encourage you and let everybody know. Well, let's see. I would encourage you, if this is your first time viewing this program, you can go and see past programs that Debbie has run, all on falls prevention and stress management. If you just go to the library's YouTube channel, or you can go to videos on demand at Quincy Access Television. We are recording this so that we can make this program available for future viewing as well. It will be available to view on Quincy Access Television. It will be broadcast, and it will also be available to watch on our YouTube channel. It is being live streamed right now to YouTube and Facebook, and we're live here in Zoom. If you have any questions, the best way to interact and to be seen is to participate here on Zoom. So I'll put links in the YouTube and Facebook chat streams with the link here to the Zoom meeting. There's no password, so as soon as you get here, Debbie or Kristin can let you in. Any of us as hosts can let you in, and we'll be happy to let you in. When you do arrive, we have set the settings so that your microphone will be muted, just because we've had issues with folks inadvertently sharing things that they didn't mean to admit on their mic, and we've had some not so kind people doing some nefarious things as well. So just to keep everything calm and safe for everybody, we have everybody muted. But if you would like to speak, you can simply use the raise hand function if you'd like in Zoom, or you can just kind of wave your arms all around, and especially when they're not sharing a screen, it's a lot easier to see everybody, and they can, acknowledge you. And they, any of us as hosts can ask you to unmute yourself, and that'll give you the power to speak. If you do speak, your video will be broadcast across the recordings and across YouTube and Facebook, so just keep that in mind. Obviously, if you're seeing folks here on Zoom, you know that you can be seen, and that's your choice. And I'm not trying to encourage anybody to hide. I love everybody being open and transparent. I just want to be open so we all know what we're sharing. We're intentional about how we share. The other way to communicate is by chat. So you can put something in the chat stream, just chat with the host. It's limited to conversation just with the host, so you won't be broadcasting your questions to the world. You'll just be sharing with us. So if you do have any questions as we go through, please just also feel free to put it in the chat. That's also a great way to communicate if you don't want to speak and have your video shared and all that. So that's the big stuff about how this meeting is going to run. I do want to encourage everybody to go and check out the library website and look at other programs that we have happening here at the library, because we always have lots of fun stuff happening. If you just go to thomascranelibrary.org, you can find a whole calendar of events. This month, what I think is going to be one of the most popular programs is happening next Monday evening. We are welcoming back Sean Murphy, who is an Irish historian, and he's going to talk about the history and celebration of Christmas in Ireland. It's a really fascinating story. I actually just got to sit down and talk with him, and we filmed a little promotional interview to help tell you more about it just last Friday. And there's some really interesting stories there. As you may not be maybe familiar, maybe you're not, Christians have not always been the majority in Ireland. So, I always thought that, some of the Christmas traditions were very, didn't really strike me as really, there's the disconnect between stories and the practices and trying to understand where they came from. And I always thought, oh, maybe this is, living in a Catholic dominant culture. This was imposing Catholic on earlier traditions. And well, I won't give it away, but it's a little more complicated than that. It's a really fun story. So I encourage you to come check it out at 7 o'clock next Monday evening. If you can't make it, you can catch a recording of that as well, but it's always best. I encourage you to be here live like you are, hopefully, with me today, if you're watching this live. So there's lots more happening on the calendar. Go check it out. You don't need to hear any more from me, though. You're excited to hear from Debbie and our friend Kristin, who's joining us today. So I'm going to turn off my mic and my video and pass it all over to Debbie and Kristin. Have a great morning. Take care.
Well, thank you so much, Clayton. And again, thank you to Quincy Public Library for allowing me to be able to continue to do my work, which is doing outreach and promoting programs on health and wellness. Particularly in these series, I've been sharing falls prevention measures and also stress management skills to help the aging adult during difficult times. It doesn't just have to be during COVID, but just during our whole lifespan. So today I am very excited. We have one of the awesome physical therapists at Tufts Medical Center. Her name is Kristin De Jong. And she's going to be talking and sharing with us some really cool tips on how we can become stronger, especially during the colder season and also with social distancing, what we can do to help maximize our strength, our balance, our coordination, and share with us some exercises at the end. So Kristin, take it away.
All right. Thank you to both of you for having me here today. I'm happy to be here to be able to speak to you about a topic near and dear to my heart. I love helping people move and making sort of the most out of what they have around to be able to do it with. So a little bit of talking first. I'm going to attempt to share my screen, a little presentation here. This one. All right.
Yay.
I think I've got this going. Can you all see that?
Yes.
All right. So I'm talking today about fall prevention. And so who am I? My name is Kristin. I'm a physical therapist and a board certified orthopedic clinical specialist with some specialty training in vestibular rehabilitation. So I actually work with people. People are referred to me with some balance difficulties for different reasons. So I have specialty training in both helping people with mobility issues due to joint limitations as well as balance limitations and vestibular dizziness issues. So what is a physical therapist? So physical therapists are movement coordination experts who improve quality of life through hands-on patient care, education, and prescribed movement. So PTs, we work in a variety of settings. So I work here in our hospital's outpatient clinic, but there's also physical therapists that work in private clinics in the community, at rehabilitation centers, nursing homes, acute care in the hospital, teaching people how to move around again after, various illnesses or injuries, and just so in people's homes as well. So there's a lot of different settings that physical therapists can work in. So here, why am I here today? So I'm going to talk about falls, why fall prevention is important, give you some tips on how you can prevent falling, and show you some simple ways that you can remain active. I know it's challenging times right now. It's beginning to get into the winter where we're getting the cold, icy season. So some considerations in that way too. And we are spending a lot more time at home now with the quarantine. So being able to sort of be active within your own home and what you have around you. So first I thought it'd be good to talk about what is a fall. So a fall is any event that leads to an unplanned contact with the floor or supporting surface. You can fall into a wall. It doesn't necessarily have to mean actually going down on the ground. That is not the results of a push or shove or a medical event like a heart attack or fainting or something like that. So also, almost just as important is what is a near fall. So a near fall is a stumble or loss of balance that would have resulted in a fall if you were unable to catch yourself. So two very important things, falls and near falls, because they are both things you want to avoid. Just some facts about falls. 1 out of 5 falls can cause a serious injury like a broken bone or head injury. Each year, 3 million older people are treated in emergency departments for fall injuries. This is a pretty big problem that we see. And over 800,000 patients a year are hospitalized because of a fall injury. So most often it's a hip injury or head injury, 2 pretty serious complications. So each year, 300,000 older people are hospitalized for hip fractures. And more than 95% of these are caused by falling, usually falling sideways against a supporting surface. Falls are the most common cause of traumatic brain injury, so head injuries in the population. And in 2015, the total medical costs for falls totaled more than $50 million. Medicare and Medicaid paid for about 75% of these total costs. So it's a pretty expensive and pretty serious thing, these falls. So factors that can lead to falling. So as you can see, this list is pretty big. So there are lots of things to kind of consider in your risk of falling. History of a previous fall, sedentary lifestyle, poor overall health, advanced age, leg weakness, fatigue, medications, footwear, use of assistive devices to walk. So this is a pretty long list, but luckily physical therapy can help with a number of these things. So my role in fall prevention is helping people with a number of different issues to be able to maneuver around these things and help reduce your risk of falling. So some important things, what to talk to your doctor about. So as I mentioned, risk of falling with medications. So medications, make sure you know the names of all your medications, your dosages and schedules, what you're taking each medication for, and carry an updated medication list with you. Share it with all your providers. This is important because there are side effects of medications that can cause, you to have an increased risk of falls. Talk to your doctor about any changes in vision or sensation. Vision, so your ability to see and your ability to feel the ground underneath your feet. Those are two very important things for your balance, two huge components of your balance that if one or both are affected can really increase your risk of falling. Any depression or anxiety, that's another factor that can contribute to risk of falling. Difficulty with your memory or need for any assistance or other services at home. So there are services that can be provided at home to be able to help you manage with all these things. So, and always check with your physician before you start with any exercise program. So, couple things you can do to make your home safer. So your environment plays a huge role in your risk of falling too. So you want it to be as kind of safe as possible. So remove anything that you could trip over, like papers, any books, clothes that are on the floor, stack up the shoes on the shoe racks. Any places should be clear for you to walk. Remove any small throw rugs or scatter rugs, or you can use some double-sided tape to kind of anchor them down to the floor to keep you from slipping. It's a pretty big trip hazard to have those in your house. So if you feel like your balance is a little bit off, you probably want to roll those up for the time being, stick them to the side, or make sure they're really securely anchored down to the floor. Keep items that you use often in cabinets that you can easily get to, or on the countertop that you can get to nice and easy. That way you don't have to use a step stool, you don't have to worry about bending down or reaching up high to get any of these objects. It could be more beneficial to have them easily accessed if you know it's something you're going to use frequently. Have grab bars put in next to and inside the tub, next to the toilet. So these are simple things that you can have installed in your home that can make it easier to get up off of a low surface. So standard height toilets are actually pretty low and difficult to get off of. So simple things like installing a grab bar next to it can make it easier to stand up from there, or to get in and out of a tub, a grab bar could be helpful for those. Additionally, non-slip mats in the bathtub and on shower floors. Showering, bathing is a pretty big fall risk activity because the floors are typically slippery and they can be wet. So non-slip mats in the tub and shower floors, make sure it's dry before you get out. Improving the lighting in your home. So you'll need brighter lights to see. So hanging lightweight curtains that can, filter in the sun. Consider night lights for walking around your home during the darker hours. As we said before, vision can play a huge role in your balance. So if you have some difficulty with your vision, especially when it's darker outside, adding some night lights into your bathroom, into your hallways, wherever you be walking around at night, especially because you're probably a little bit sleepy still walking around, that can definitely reduce your risk of falling. Have handrails and lights installed on all your staircases. It gives you that extra little bit of something to grab onto for your balance. And wear well-fitting shoes with good support inside and outside the house. So this is a big thing, because the what you wear on your feet actually is what supports you from the ground up to help you with your mobility and your balance. So even inside the house, you want to try to avoid any shoes that you slide into, anything that doesn't have a back on it. You want something that fits snugly around your foot that you can tie up tight and wear on your foot. Look out for worn soles of your shoes too, because those can be definitely a slip hazard. If the soles are worn down, they're more likely to slide on a hard floor. Being active. This is my bread and butter on what I do. I teach people how to remain active, how to become strong and move around. So being active does not mean you have to go to the gym and work out every day there. There are easy ways you can stay active in your own home. Easiest to do, set aside a time every day for what you want to do. It's really challenging sometimes to kind of throw it into your day-to-day routine. So setting aside each time every day to do what it is that you're going to exercise, and make sure you have a plan for what it is that you're going to do. Another good way to make sure you do your exercise, find a buddy. Hold yourself and hold others accountable for being active every day. So be it your roommates at home, be it your friends via Zoom or another form of video conferencing, hold each other accountable. Set up regular exercise dates that you can all be together, and it makes it a little easier to fit it into your day-to-day life. And it's nice to see people doing it as well. People who exercise with friends are more likely to be regular active. So I've participated in many a Zoom workout over this pandemic. And figure out what it is that you like to do. So that's important. If it's not meaningful to you, you're not going to enjoy doing it, and you're more likely to stop doing it. So figure out what it is that you like to do. I'm a runner. I like to run, so I like to get out and do that. But there are other options for that. You can also, if you enjoy yoga, there's yoga you can do. There's strength training things you can do. So find something that you enjoy doing that works for you. The internet is full of all different types of exercise programs. So you can find a lot of different options just on the internet. For all varying ages and fitness levels. So if you don't enjoy one of those, look, search, find another. But most important is it's something that you want to do. And don't get discouraged if you miss a day of exercise. Just restart again tomorrow. It takes about 30 days to make something a habit, so stick with it. So actually pretty soon you'll learn to realize you miss those days that you work out too. So that's why kind of setting that time initially, set aside that time every day that you know you're going to exercise, and it becomes a habit and just part of your routine, and it eventually just works its way right into your life. So remember, listen to your body. Exercise should be somewhat challenging, but never painful. If your body tells you you need a break, listen to it. You can always jump back in at a later time. Set up your space before you begin exercising. Again, you want to make sure your space is clear, that you have a wide area to work with, that you have anything that you need for support, a countertop, a chair, and any other props that you need to do your exercises right there with you before you begin the program. Make sure all clutter is out of the way and that you're ready to begin working out. Keep hydrated. Good for you for exercising. Drink that extra glass of water. So always have that glass of water nearby for if you need it while you're exercising. So before we get into exercising, I have a couple different additional resources for you to be able to sort of look in on your own. So on the web, the National Council on Aging has a bunch of resources for older adults and caregivers. So educational brochures, tip sheets, exercise and physical activity guidebooks. It's a great resource for some of this, some success stories, and a lot of different other useful information. So if you visit that website, they'll be able to give you a lot of information as well. The Centers for Disease Control and Protection, they have links for fall prevention resources and other related resources. And there are a number of different community fall prevention programs. Two of the big ones, one is called Stepping On. So it's a group program that focuses on older adults and reducing the risk of falls and improving their quality of life. So that's one particular program. And the Otago exercise program as well is another exercise-based home program delivered by physical therapists. So it incorporates some balance exercises, strengthening programs, and they're all of varying different lengths. Also, your local council on aging, they're a great resource for being able to direct you to other resources and kind of more community-based, more local-based exercise programs and workshops to be able to do different things as well. So, all right. So that is my little tidbit on falls and activity. Are there any questions for me now before we begin our little exercise program?
You can either type it in the chat or you can unmute yourself, or just raise your hand and I can unmute you. And you know what, while people are thinking about a question, I just want to share with you, earlier at the beginning of the year, one of my sisters had a acoustic neuroma surgery, and it wasn't until that's a little growth on her ear canal, and it really impeded on her ability to hear, and it was starting to she was starting to experience some numbness to her face, so she needed that piece of tumor removed. So it's basically brain surgery. And one of the side effects is balance and coordination. So it wasn't until she was going through the process that I learned about vestibular physical therapy and how important that could be. So
absolutely, that's definitely a part of what I do as a vestibular therapist too, kind of retraining the whole balance system, the coordination of the balance system to work together again as well. So.
Yeah, it's very fascinating. She's done so well. And more recently, my husband just had a knee surgery, a total knee surgery. So we've been having home physical therapy, and he was just discharged from home physical therapy last week. And today, later on, I'll be taking him for his first outpatient physical therapy appointment. So this is perfect timing that you're here.
Yeah, this is what I do.
Yeah. So I think, Dan, do you have a question or something to share?
What is vestibular again?
So the vestibular system is the system within your body that deals with balance.
No, using the word to define itself. What's vestibular?
So it's a system within your brain and body that connects the balance system of your inner ear to your ability to move around. So your inner ear is responsible for balance and sort of your sense of position and movement throughout the world. So the vestibular therapy deals with the inner ear balance issues to be able to balance that out again and coordinate the inner ear balance with the rest of the body system of muscles and vision.
Yeah.
Okay.
Yeah. For such a small little thing inside our ear, our brain, it really impacts our ability to walk and feel like we can be upright.
Yes.
Absolutely.
It's really important. Okay. Anybody else have any questions?
No? Okay. All right.
All right.
Perfect.
Okay. Feel free to ask questions though along the way. Would that be okay, Kristin?
Absolutely.
Okay. So what's next?
So we're going to do a little bit of an exercise program. So when you're doing any exercise program at home, like I said, it's best to make sure your space is clear, that you have any rugs tied away, anything that you might kind of get underfoot out of the way. Have a sturdy chair with you and a sturdy countertop as well, or something like that won't tip over so easily. So I'm going to back up my camera a bit so you guys can see me. I'm in my chair over here. All right. So A good way to warm up for any exercise program is to start with a lot of gentle movements. So sitting upright in the chair, feet planted on the floor, and your sits bones sort of right near the end of the chair to support you. And I like to think of it as going from the top down. So warming up the muscles in your neck first. So rotating to the side and the side. Just go through a comfortable range of motion. Don't force anything. Don't move too quickly. Do this about 10 times.
This feels good. I can hear my neck cracking.
Yeah, joints are pretty noisy things, so getting everything loose will be pretty good. All right, I think I got 10 done there. All right, so next step, we're gonna do shoulder rolls. Warm up the shoulders and the upper back. So you're gonna rise them up, bring them down the back of your back. We'll do 10 of those. 2. I love this one. It helps me take nice deep breaths as well. All right, couple more to go here. And last one. Great. All right, so now we want to warm up the upper body and the waist. So you're going to gently turn your body to one side and turn your body to the other. Go back and forth in a nice, smooth motion, kind of waking up those muscles on your side, along your back. Let your head come along for the ride. Feel nice, gentle movement and the muscles warming up. Nice, comfortable motion. Nothing too strenuous at this point. I think I've got 2 more to go. And last one. All right, we recenter ourselves. Let me see if I can get my camera down a little bit here. All right, so next we're gonna start to warm up the lower body as well. So I've got my feet planted, my sits bones at the end of my chair, my body upright, and we're going to bring one leg up a little bit, followed by the other one. Wake up those hip muscles. You ready?
Kristin, is it better to do these type of warm-up exercises slowly or fast? What do you recommend?
So you want to do all these exercises with slow and controlled movements. You want to feel that you're in control of the entire movement from start to finish. So that way your muscles get the best benefit from it, and you really strengthen those muscles and work on the coordination of your muscle system.
Okay.
Great. All right, one more each side. All right, I can feel my body getting warmer already.
Yeah.
Next, we're going to do a gentle stretch for the hamstring. So one leg will go out straight. Your body stays upright. Knee straight on the one leg. Bend your body gently forward from the hips. Keep your body upright. You should feel a gentle stretch along the back side of your leg.
Should the toes be pointed or pointing
Keep your toes as relaxed as possible.
Relax, okay.
Yes. So as you relax them, hold that about 10 seconds. We're going to come back up and we'll switch sides. Leg out straight, body upright. Lean your body forward. Feel that gentle pull. 2, 3, 4, 5, 6, 7, 8, 9, 10. Come on back up.
And what does the hamstring do, especially when, as far as walking and coordination, balance?
So the hamstring is one of those important muscles that sort of push you forward as you're walking. So it helps to bend your knee. So it lets you be able to lift your foot up off the floor and clear your toes so you don't catch your toes as you're walking. And then it also propels you forward as you sort of come over your leg. So it's an important muscle to give you that sort of oomph going forward, as well as being able to lift your leg to clear your foot so you don't risk tripping over your toes when you're walking.
Good to know.
When you don't have enough flexibility in the hamstrings, it can also lead to things like back pain and hip pain. So it's a good muscle to sort of stretch gently pretty frequently.
Yeah.
All right. So nice loose hamstrings now. Now we're going to warm up the quadriceps muscles. So these muscles here on the front of your thighs. This is another important one that helps you climb the stairs, helps you propel yourself forward as you're walking. So with your upright posture is very important. You're going to gently extend one leg out. And then the other one. Try to avoid leaning your body backwards as you do it. Try to keep your body upright. That'll work on your core control as well. Core being very important in your balance. Alternate these legs. The quad muscle is one that helps you get up and down from the chair, on and off the toilet. So another very important one in just sort of your day-to-day activities. All right, we'll do one more each side. Beautiful. All right. And last on the top down chain is getting the ankles warmed up. So feet planted on the floor, feet underneath your knees. You're going to rise up onto your toes, come down, and then rise onto your heels with your toes off the floor. Warming up those calf muscles. I've got my nice comfortable workout shoes on. That way I can get ready to do the rest of my exercise program. All right. Perfect. So that's our little top-down warm-up, getting all those muscles moving and ready to do the rest of our exercise program. So for the rest of the exercise program, I'm going to use my table here, which is like a nice sturdy countertop type of thing, because you want to be sure you're safe at home when you're doing all these things. So we're going to do a couple exercises standing up. Got you over here. Okay. So one hand secure on my table for some balance. If you have a sturdy chair, too, you can use that. So something that would have a good sense of balance for you. Okay. And we're going to start with some marching. So body upright, posture tall. Raise one leg up and the other. 2, 3, 4. This mimics the motion when you're walking. So when you walk, you have to be able to bring your hip up like this, not to this degree, but this will help to strengthen those muscles on the front of your hip that allow you to bring your foot up while you're walking. One more each side. And 2. Good. All right. So the next exercise for your balance. Okay. You're going to have your hand on your surface for balance. You're going to stand on one leg. Bring your foot to the front. Put it down. Stand on the leg. Bring your leg to the side. Put it down. Same leg to the back and put it down. So this is working all of your hip muscles in all different directions. Notice when I'm doing this, I'm trying to keep my body as straight as possible, controlling with my core, which is important for the balance and also helps to strengthen the abdominal muscles and the back muscles to give you better posture and stability. All right, one more time around the world. To the front, to the back side, and the back. Nice controlled movement. Great. And if at any point you get tired, because that stance leg does get pretty tired, you take a break and then restart again later. Now time for the other side. Okay, got my support surface, body up tall, front, side, back, front, side, back, front, side, back. Great, one more time around the world. To the front, to the side, and to the back. All right, really feel that in my hip muscles here. So next thing we're gonna do, we're gonna work those side hip muscles a little bit more. They're very important in walking. So I have my support surface. Depending on how long your support surface is, you can take a number of different options. If you have a very short surface, step to the side, step to the side. If you have a longer surface, you can take a couple steps one way and then return to the other way. I'm trying to use my hands for balance on the surface, but try not to lean all my weight on the surface. I have them there to give me some support. All right. Beautiful. How's everybody feeling?
Feels great. I could really feel my hip muscles getting the workout. Didn't realize how tight they were.
These are muscles that can get weak pretty easily. So we want to make sure that these hip muscles get strong to support you because they're the ones that got to lift you up and lower you down whenever you're doing anything. So the next thing we're going to do is a little bit of balancing. So I have my support surface here. You're going to try to lift up one leg. Just balance on it for as long as you can. 3, 4, 5, 6, 7, 8, 9, 10. Good. And then you can alternate it for your other one. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Switch back over here. This one could be pretty tricky. You definitely want to be sure you have that surface next to you. And if you need to put your foot down, that's fine. So if you feel more comfortable, you can lift up and put the toes of one foot down, not fully lifted off the floor. That way you've got 2 feet touching the ground, and you can do it the other way as well without needing to lift fully up. Beautiful. All right. And that one it can be a little bit tricky. You can make it a little easier, I said, by putting the foot down, or you can make it a little harder by holding it up for a little bit longer, or doing some of those movements, your general head movements and things like that. That could make it a little more challenging as well if just standing on the one foot becomes a little bit easier. All right, so next exercise We're going to stand with one foot in front of the other, hand on the support surface. If you don't feel comfortable with 1 foot heel to toe, just take a big step forward with 1 foot. That way your feet are apart and staggered a little bit, one in front of the other, but they don't have to be directly in front of the other. And you can hold your balance here, 2, 3, 4, 5, 6, 7, 8, 9, 10. Switch sides. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. To make it more challenging for myself, I'm going to put 1 foot directly in front of the other. But like I said, keep your feet separate if that's what is the best for you. 5, 6, 7, 8, 9, 10. And switch again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Beautiful. Get your feet straight, shake it out a little bit, get nice and loose. All right, so I'm gonna grab my chair here. So I have a nice firm chair. This one does not have arms. We're gonna use it for the next exercise. So you're gonna sit down with your upright posture, body up tall, feet on the floor, sitting at the end of your sits bones. And without using your arms, you try to rise up from the chair and sit down with control. So if you need to use the arms a little bit, that's okay. You can use push on the side or on your thighs. It's just as important to go slow on the way down as the way up. That downward motion is what controls you against gravity. So I want to make sure, I like to say, pretend like you're sitting down on a glass coffee table. You don't want it to crack. Beautiful. This is another great one for the quad muscles on the front of your legs, as well as the hip muscles in the back side.
Does it matter? Oh, sorry. Does it matter where your feet are? Is it too
Yeah, you do want your feet planted under your knees. So you don't want your feet too wide. So I've got right under my knees. So I'm leaning forward. So they're not super wide. So they're right under my, and as I sit down, what I'm looking to do is lead the motion with my back side. So as I stand up, I lean my body forward. As I sit down, I push my backside back. So we say nose over toes, lean the body forward. Come on up. And then sit down, push the backside back, and sit down. So this is an exercise that I incorporate into sort of anytime I get out of the chair during the day. So I think of it as an exercise every single time I get out of the chair. Plant my feet, try not to use my arms, use the power of my legs and the coordination of my muscles to move me upright. All right, perfect. And final exercise here. I've been talking a lot about posture in your upright body because it's very important. The more upright you are, it helps with so many different things. So it helps your muscles to coordinate a little bit better. They're a better line to move up. It helps with your vision to be able to see the world around you, which is, again, another important component of your balance. So posture is very big. So we're going to work on the muscles of your back that help to strengthen that back to bring your body into that upright position. Feet planted on the floor, body upright, upper shoulders relaxed down. And you're going to squeeze your shoulder blades together, spread your collarbones, hold 2, 3, 4, 5, and then relax. Good. Spread your collarbone, squeeze your shoulder blades together. 2, 3, 4, 5, and relax. 2, 3, 4, 5, relax. 2, 3, 4, 5, relax. This is another good way to get those deep breaths in too, as you open your rib cage, expand your lungs, fill them up, and then relax out. One more time. 2, 3, 4, 5, and relax. And shake it out a little bit. All right, great job, guys. That is a little bit of an exercise program to kind of hit the main key points. You want to do your slow and gentle warm-up whenever you're getting ready to work out. So as I said, I like to think of it as top-down, gentle movement of all of the body parts. Nothing too painful, always pretty slow. And then we get into some of the more balanced activities and strengthening activities for the legs. Always with something next to you for support, or somebody next to you as well if you feel you need that for your balance.
Mm-hmm. Mm-hmm. Right. This is great. I really appreciate all the different techniques you shared with us from head to toe. How many minutes do you think it would take this whole routine to do in the morning? 10, 15 minutes?
Yeah, somewhere around that time. And so what I'll often say is you can have a list of exercises to do, and you don't have to do every exercise every day necessarily too. You know, you can pick 5 to do one day, another 5 to do the next, or split them up during the day. I'm going to do these 5 when I wake up in the morning and these 4 before I go to sleep at night, wherever you can fit it out during the day. So in general, if you can carve out about 5 to 10 minutes at a time, at least, to do a couple exercises, that's pretty good. In exercising somewhere around 15 or 20 minutes total throughout the course of the day, be it in one bit of time or spread out over the course of the day.
Mm-hmm. Are there ones that's good to do, especially, so this is a 2-part question. People who are on the computer a lot, Zooming a lot. Are there any type of exercises that you recommend to help loosen the neck, or people on the phone, the text neck? And
yes.
The other part of the question is, are there any particular type of exercises or stretches that's good to do at bedtime to help us relax our body?
Mm-hmm. So both great questions. So culture today, especially with the Zooming that we're all doing, is to have this posture that's way down here. So you end up with thumb problems, with neck problems, with shoulder problems and back problems. So those ones that sort of open you up. So those shoulder blade pinches, that's a great strengthening one for the upper back. So you can do those seated or you can do them standing. So they're a good exercise to do for those too. To do the shoulder rolls, I prefer the backwards position for the rolls because again, that opens up everything, strengthens those muscles that sort of spend all day hunched forward like this. So this is a good one to relax the muscles, and then to strengthen them, you do the shoulder blade pinches, the spreading of the collarbone. So the neck movement one is great too, after spending so much time staring in one position. Anything you can do to get out of one position for a long period of time. So kind of shifting the positions pretty frequently and kind of looking for the reverse of whatever that position that you're in is.
Good point. Good point. Yeah.
And I like to do a lot of the breathing exercises, the one that you can incorporate your breath to before going to bed at night, because that's a good way to kind of wind down, to get the muscles loose and the sort of whole body relaxed and ready for going to bed. So the breathing with the rolls, the breathing with that sort of whole top-down warm-up can be used as like a little relaxation program as well.
Any type of exercises or leg warm-ups that we should be thinking about before stepping out into, it's going to be winter soon, it's going to be snowy soon, icy and slushy and slippery. Anything that you could share with us that can help maximize our ability to maybe wake up or strengthen the feet muscles or the leg muscles?
So it's always, even before you get out of bed, it's a great idea to just get the ankles moving up and down a little bit, get the blood pumping, it gets those joints looser and the muscles ready to sort of get you about your day-to-day activity. So starting from the feet up, you can do a little bit of that warm-up program. Ankle pumps in bed. You can do little knee bends in bed also. That helps get your muscles moving and the blood pumping. One of the big things is walking around on the icy surfaces is footwear. Always make sure you've got some good footwear on because that's going to support your foot and help to decrease any of that slipping on the ice. Your hip muscles, so all that hip muscle work that we just did, that's all very important for your stability on the ice as well. That's what's going to help your balance and stability as you're moving around.
Mm-hmm. Mm-hmm. And any particular type of exercise? So this, I asked about walking. How about going back to the people who are on the computer with the wrist, or people with carpal tunnel or arthritis? It seems to be, it gets worse when it's rainy or cold, So what are some good exercises for the upper extremities? You shared with us the shoulder roll. Yeah. Any particular exercises for our elbows, forearms, wrists?
So elbows, you want to make sure you can, I call it the open book. So you can turn the pages of the book. You get the hands moving, that elbow movement here. And then you can do shoulder taps. Because at the keyboard, your elbows are bent all the time. So you want to do full elbow straightening and be able to do that to loosen those up. The hands, you want to do full open and close to the fingers. Let them fully extend and come together. And then a little coordination. You can touch your thumb.
Oh, I love this. Yes.
Each finger and go back. So working that sort of dexterity, the coordination of your finger movements. And then rolling out the wrists.
Awesome.
Movement is good.
Any type. I love how you shared in your slide how activity is important, and it doesn't mean going to the gym. It doesn't mean going out for a run, because for some people they may not like it, or it's just not practical for some people. So being active, just doing a little bit more than what you normally do is so important, right? That's the name of the game, is just kind of keep moving the joints.
Keep moving, keep those joints lubricated. That's what's gonna keep you going. But even day-to-day things you do at home, like your household tasks, that is exercise. That does require a lot of energy. So vacuuming, sweeping, cleaning the countertops, even standing to chop your vegetables to cook. That's an exercise as you're standing up to do these things. So that's your body's, activity. And so if you add in just a couple thoughts as you do those things, so as you're standing to chop your vegetables, pull those shoulder blades back, keep your core strong, and think about doing those too. Just adding a little bit makes that thing that's already an exercise even a little bit more of an exercise too. So even day-to-day things that you do expend energy, do burn calories, and are good for you. So it's hard to do a lot of things all at once. So if you break them up to a little bit during the day, do your vacuuming in the morning, take a breather, let your body sort of recover through that, then do your meal prep, and then do your balance exercises later on, kind of splitting things up and giving yourself the break in between. So sort of starting to do that at first, you're going to notice you can do more and more and more and more in a row as time goes on.
Yeah. I have one more question. I have so many questions. So as far as, the scenario could be, okay, the person has done their exercises, they're taking care of themselves, they're eating well, and yet maybe they kind of slipped and fell or bumped into something without, thinking about it. What are your advice as far as how do you care for those type of minor injuries, I would say? Would you ice, or would you use heat? Would you alternate? Certainly seek medical attention, right? Especially if you're feeling a lot of pain, and if you have a big gash. But if it's something that you feel like, oh, okay, this is fine, I can take care of this at home, what would you recommend as far as care for those type of injuries?
Sure. So typically right away, you're in sort of that acute stage, that inflammatory stage. So what we want to do is kind of calm that inflammation down. So any of that extra activity, you want to kind of cool and quiet down. So typically, bumps, strains, sprains, in that first period of time, ice is usually recommended. So that kind of calms the inflammatory process. It actually helps with pain management as well. It can help decrease the pain there, it can decrease swelling if you have it. It kind of gets you over that acute inflammatory stage. So helps you kind of get past that first couple of days of all of that too. So generally the rule with ice is you want to leave it on for 10 minutes and then check your skin, because you can actually burn your skin with the ice. So you don't want to leave it on for a long time, but you can put it on for 10 minutes, take it off for another 20, and then put it back on. You can do that frequently throughout the course of the day. Heat, we more reserve for like a later on stage when you're not as likely to be as inflamed or as swollen, because the heat could potentially make things a little bit more swollen too, because it causes a little bit more swelling in the area. So heat would be good sort of in the later bits of like a pulled muscle or something like that. Like if you have something that feels really tight and pulled, the heat can help kind of relax things, as long as you're not in that like inflammatory, like right after an injury type of stage.
Good point. So for something that's acute, something that just happened, it's good to ice. So think ice, ice baby. And then after 2 days, if you still feel like there's tension around that area and you want to be able to soothe it, applying heat.
Yeah.
And
generally, whatever feels good too.
Yeah,
Like after
okay.
that acute stage, if it feels not good to put the heat on, continue with the ice. That's great. Yeah.
And I love how you shared that we can get ice burn, which is so true.
Yes.
Yeah. Which it's kind of like a option. Yeah. It's like, okay, what? But yes, we can get ice burn, right?
Absolutely.
Any common type ice bags that people can use, like in their home, if they don't have a nice, wonderful, sophisticated ice bag, what can we use at home to reach for?
I take the bag of frozen peas out of the freezer, actually, because that's a nice size. It's a nice square size typically. And because they're peas, they're pretty small, and it can kind of fold right over wherever you need to put it. So I literally have a bag of frozen peas in my freezer that's labeled ice pack, because I don't want to eat them later, but.
Oh, wonderful. I love it.
But any frozen vegetable will do. I tend to like peas just for their shape. But.
Yeah. Oh, that's a very good tip. Very good tip.
Yes.
Thank you so much.
Of course.
Anybody have any last questions or any comments? Did they enjoy this program? Thumbs up or questions, put it in the chat. Oh, thank you so much. We get a thumbs up. Wonderful. Oh, very good. Oh, very valuable. Okay.
Yeah.
Thank you. So people have chatted. It's been very valuable, and they love the exercise and just the different types of tips you've given us. Kristin, I want to thank you so much for your time and expertise. This was really a great program. So thank you.
Meet all of you.
Yeah, thank you. Is there one, before we have a few seconds left, is there one last tip that you can give us to motivate us to keep active during these times?
Yeah, find a buddy. Find a buddy. I think that's one of the biggest things. It's, be it again on the computer, meet with your friends, your partner at home, find a buddy, get yourself together, and a little bit of, it doesn't have to be a whole 30 minutes, it could be 5 minutes of exercise, just getting out there and doing it.
Yeah, great. Well, thank you. So having an accountability buddy
Yes.
somebody who could really root you on, pick you up, help you be able to maybe be more active,
Yeah.
or somebody that you can cheer up and help be more active, right? It's a
Or
just two-way
two-way
street.
street.
Yes, yes, yes. So I want to thank you, Kristin, physical therapist from Tufts Medical Center, for being here with us today. As we wrap up this hour, I just want to remind people I'll be back on December 15th, 10 a.m. to 11 a.m. And I hope to have a special speaker then. So more to come about that. But until then, I wish you all a great and happy and safe 2 weeks. So Kristin, thank you again. Thank you, everybody. Bye.